Good evening for everybody. I'm Eija Paavilainen. I'm professor of nursing science in Tampere University, Faculty of Social Sciences, and I'm from Health Sciences unit. And my topic today is promoting mental health of children and adolescents. And in my case, in my presentation, the perspective is from child maltreatment prevention. And I will show you here my topics today. I am concentrating on family perspective, on child and adolescents' mental health, what it means within the family, these issues. And we know that child maltreatment and its impact on children's mental, physical, and social welfare are quite huge. And I will describe it as the first issue, and then about risk factors of child maltreatment. And then I tell you about our mobile application Family Needs Checklist for parents for preventing child maltreatment and advancing family well-being, which we developed together in our ERICA project, together with the Mental Health Network. And first, what is child maltreatment? It means it is a part of family violence, which is of course directed at family members or loved ones. And abusers or maltreaters can be both parent, both sexes can be maltreating their children. It means physical, emotional, psychological, sexual, and neglect are those forms of child maltreatment, and it can be directed to one child or indirect, as for instance, as an emotional maltreatment to other children when one is maltreated, for instance, physically. And its forms are very diverse. Its different forms are simultaneous. For example, physical is always accompanied by emotional maltreatment. It means also threat of violence, and it is also a crime in many countries' legislation. And of course, this has differences all over the world, how we defined it, but basically, these are the forms of child maltreatment. And consequences of child maltreatment are quite huge, and all forms are a great risk to child's health and welfare, even life. And it prevents normal physical, mental, and social development of the child, and it impairs learning, affects child's behavior, and it somehow creates a series of events that lead to the stress. They talk about toxic stress, and it causes changes, for example, in developing nervous, circulatory, immune, and metabolic systems, even the brain of children and adolescents. And recently, increasing attention has been paid to child neglect and emotional maltreatment. And we have noticed by research that parents don't necessarily know what this means in everyday life, what they can cause to the child. And in the same way, quite big attention is nowadays drawn to intergeneral transmission of maltreatment and the phenomenon, ACE's phenomenon, adverse childhood experiences, which most often refers to the maltreatment of a child. And globally, and of course also in Finland, where I'm from mostly and done my research from our country's perspective, we know that child maltreatment within the family is a global concern and a quite big public health problem globally. But based on research studies, it has been estimated by WHO that between 9 to 30% of children suffer from maltreatment, meaning physical, emotional, or sexual abuse and neglect internationally. And really, the statistics concerning real figures is very challenging. All child maltreatment cases are not being identified. And in different countries is being tried to take care of the issue as well as possible. And for instance, WHO and UNICEF and other similar kind of organizations are supporting this development. And however, all countries do not define child maltreatment as a crime. All kinds of forms of maltreatment, also emotional and neglect, are very harmful for the child's health and well-being. And in Nordic countries, it is typical to see child maltreatment also as a crime, and ban it by legislation already in 1980s. And this has decreased parental child maltreatment, for instance, in Finland, however, quite slowly, and attitudes for using physical discipline are decreasing. However, about 44% of adults still use physical discipline, and we mean child maltreatment by that. And it has also many risk factors, and we have made a systematic review on this. And these concern parents, family situation in general, or the child. And we had made in Finland a national clinical practice guideline already in 2008, and the latest update was on 2022. So it was last year updated according to our in the cooperation with our Eija project. And risk factors of child maltreatment can be divided in three forms for parents, family, and the child. For instance, parental mental health problems, young age, single parent, rigid parenting style, and so on. And in the family, there may be intimate partner violence, history of child protection interventions, family stress, social isolation of the family are also risk factors for child maltreatment. And connected to the child, complications associated with pregnancy and birth, and for instance, crying of the child can lead to child maltreatment. But I want to stress that the single risk factor alone is not indicative of child maltreatment, and the situation of the child and family needs to be considered as a whole. And the accumulation of multiple risk factors increases the risk of child maltreatment. And if you want to look at our guideline, it's also in English in this link. You can find it there if you want to look at it in more detail. And then something about mental health issues concerning families and children. Children's and adolescents' mental health problems have grown in last years. This is really a growing concern around Europe, as Emma already told to us. And the life situation of youth is quite challenging, and it seems that present society adds those challenges: climate issues, social media, digital equipment, and so on can add those things. And also COVID-19 has also had a big impact on children and adolescents' mental health, increasing worries and ill-being of families with children and youth. And especially most vulnerable families with children have been suffering the most. Parents' physical and mental health problems add also mental health problems of children and affect their life in many ways, decreasing mental well-being. And there is a great need to take care of children and adolescents whose parents have serious physical and mental health problems and diseases. And children need to get noticed in adults' health and social care services for getting support and help, and discussions on the situation according to their needs and in their own language and on their age level. And also Enter Network has developed this kind of training for professionals in EU-funded CAMIL project earlier, as we know, and you can find this training also in Enter web pages. And then we made together an Eija project because we noticed that we need to do something to prevent child maltreatment and advance children's and adolescents' mental health. And European Commission funded our project, which aimed to prevent and combat violence towards children, defined here as child maltreatment, by building the expertise especially of frontline professionals concerning minors living in families with child maltreatment and child maltreatment risk, also in multicultural contexts. And here you can see our training and also the web pages of the whole project. And as background of our Eija project, as I told you already, child maltreatment has been extensively studied, but research data has not been sufficiently utilized in preventing and reducing maltreatment in European level. and legislation, cultural attitudes, and the definition of maltreatment vary from country to country, although the WHO, for example, has set broad international targets for the prevention of child maltreatment. And parents often fail to share their worries and concerns concerning, for instance, loneliness, stress, and child rearing practices, which can lead to child maltreatment quite easily in situations. And parents have hoped to use also digital ways in sharing their worries, especially with professionals in child health and welfare services. Our EU-funded multidisciplinary Eija project in 6 countries, Finland, France, Italy, Germany, Poland, United Kingdom, meaning England and Scotland, tried to seek ways to remedy the situation. And in our EU-funded Eija project, we have developed an European freely available online training program on risk assessment and identification of child maltreatment. And we also developed a mobile application for parents, family needs checklist for parental self-assessment regarding their needs for family services. And how this application is being used. Parents respond to the statements in the application. There is 28 items about the situation of existing risk factors within their family. And after responding this, they receive feedback on what their situation looks like, information on why these things are important, and they get also links to more information and advice on who to contact if they need discussion and support. And parents can save the result and feedback in their own device, and they remain only for their own use. No professionals will have access to the answers without parents providing them. And they can show the result to a professional, for instance, public health nurse, social worker in daycare, and so on, while visiting in a service and start discussing based on the result. And here you can see the link to the mobile application, which is in different languages there, also in English. And here you can see the examples of items in the application, and they are based on our risk factors, which we have noticed in international multidisciplinary research. And examples you can see here: I was maltreated as a child. I have experienced traumatic events as a child. I'm not always able to control my child's disobedient behavior. My life is currently stressful. I am a single or divorced parent. My child cries a lot. And the parent answers to these yes or no, and based on these answers, they can get feedback, and after that, they can possibly go and discuss with some professional about their situation if needed. And then how to advance child and family welfare and to prevent child maltreatment. What are the main issues on this? Needs of the child and families will always be in the focus, and services should be of high quality, and development of them should be based on research evidence. And cultural aspects are very central and important in developing services and different tools, as we noticed in our Eija project also. We discussed a lot about these cultural aspects when we developed our training and mobile app. And professionals also need to know what are the risk factors of child maltreatment and use this knowledge as needed in their work. And both knowledge and skills should be in high level. Multi-professional collaboration is really needed according to the child and family needs, and early identification of children in risk is needed, and effective support, treatment, and protection is needed. And I think that, and we thought in our project that this mobile app and training are good tools also in this development work in different European countries. And at least in Finland, we are now making a research based on this mobile application, how useful it is according to parents and professionals. And as conclusion, In developing our services and care for families with children, we need research evidence for basis, for instance, on families and children's own experiences, and we need multi-professional collaboration, meaning transfer for knowledge and joint concepts and definitions for issues, and joint training for developing practices in real life. And the focus should be on the child and family needs always. We need education and attitude changes also for public, for instance, concerning how to behave with children, nurture and foster them, and talk with them. And we need structured methods for family risk assessment and care. And our mobile app is one of these kind of tools. And we hope that it will be used all over Europe in some time. Here you can see some references, and also our Eija publications, which you can find also in Enter web pages. We have published quite a lot on this project, both on the training and on the application. Then here you can see one huge book on domestic violence and abuse, and it's also as an e-book, and you can find it easily in libraries, I think. It's quite new also. And then I want to say thank you for listening, and I hope that we can discuss later. Thank you.